What is docetaxel or taxotere? Docetaxel is a type of chemotherapy. It is a treatment for a number of different types of cancer. How does docetaxel work? Chemotherapy works by destroying quickly dividing cells, such as cancer cells. How do you have docetaxel? You have docetaxel as a drip into your bloodstream, intravenously. You might have the treatment through a drip into your arm. Your nurse puts a small tube, a cannula, into one of your veins and connects the drip to it. Or you might need a central line. This is a long plastic tube that gives the drugs into a large vein, either in your chest or through a vein in your arm. It stays in the whole time you are having treatment. How often you have docetaxel? You have it once every 3 weeks. Each treatment takes about an hour. How many treatments you need will depend on the type of cancer you have. Preventing allergic reactions. Docetaxel can cause an allergic reaction. To try to prevent this, your doctor or nurse give you steroid tablets to take. You usually take them for 3 days, starting the day before each treatment. You can take steroids just a few hours before your treatment. If you have prostate cancer, your doctor can tell you how often you should take the steroids. Tests before and during treatment. You have blood tests before and during your treatment. They check your levels of blood cells and other substances in the blood. They also check how well your liver and kidneys are working. What are the side effects of docetaxel? How often and how severe the side effects are can vary from person to person. They also depend on what other treatments you're having. When to contact your team. Your doctor, nurse or pharmacist will go through the possible side effects. They will monitor you during treatment and check how you are at your appointments. Contact your advice line as soon as possible if you have severe side effects. Your side effects aren't getting any better. Your side effects are getting worse. Early treatment can help manage side effects better. Contact your advice line immediately if you have signs of infection, including a temperature above 37.5 C or below 36 C. Common side effects. These side effects happen in more than 10 in 100 people, more than 10%. You might have one or more of them. They include 1. Risk of infection. Increased risk of getting an infection is due to a drop in white blood cells. Symptoms include a change in temperature, aching muscles, headaches, feeling cold and shivery and generally unwell. You might have other symptoms depending on where the infection is. Infections can sometimes be life-threatening. You should contact your advice line urgently if you think you have an infection. 2. Breathlessness and looking pale. You might be breathless and look pale due to a drop in red blood cells. This is called anemia. You may have shortness of breath for other reasons. Tell your doctor if you feel short of breath. 3. Bruising, bleeding, and nosebleeds. This is due to a drop in the number of platelets in your blood. These blood cells help the blood to clot when we cut ourselves. You may have nosebleeds or bleeding gums after brushing your teeth. Or you may have lots of tiny red spots or bruises on your arms or legs, known as petechia. 4. Allergic reactions. A reaction may happen during the infusion. Symptoms can include a skin rash, itching, swelling of the lips, face or throat, breathing difficulties, fever and chills. Your nurse will give you medicines beforehand to try to prevent a reaction. Tell your doctor or nurse immediately if at any time you feel unwell. They will slow or stop your drip for a while and give you medicine to help relieve your symptoms. Loss of appetite. You might lose your appetite for various reasons while having cancer treatment. Sickness, taste changes or tiredness can put you off food and drinks. 6. Hair loss. You could lose all your hair. This includes your eyelashes, eyebrows, underarms, legs and sometimes pubic hair. Your hair will usually grow back once treatment has finished, but it is likely to be softer. It may grow back a different color or be curlier than before. Some people may have permanent hair loss, although this is rare. 7. Feeling or being sick. Feeling or being sick is usually well controlled with anti-sickness medicines. Avoiding fatty or fried foods. Try eating small meals and snacks. Drinking plenty of water, and relaxation techniques can all help. It is important to take anti-sickness medicines as prescribed even if you don't feel sick. It is easier to prevent sickness rather than treat it once it has started.
8. Diarrhea. Contact your advice line if you have diarrhea, such as if you've had 4 or more loose watery poos, stools, in 24 hours. Or if you can't drink to replace the lost fluid. Or if it carries on for more than 3 days. Your doctor may give you anti-diarrhea medicine to take home with you after treatment. Eat less fiber, avoid raw fruits, fruit juice, cereals and vegetables, and drink plenty to replace the fluid lost.
9. Mouth sores and ulcers. Mouth sores and ulcers can be painful. It helps to keep your mouth and teeth clean. Drink plenty of fluids and avoid acidic foods such as lemons. Chewing gum can help to keep the mouth moist. Tell your doctor or nurse if you have ulcers. 10. Numbness or tingling in fingers or toes, peripheral neuropathy. Numbness or tingling in fingers or toes is often temporary and can improve after you finish treatment. Tell your healthcare team if you're finding it difficult to walk or complete fiddly tasks such as doing up buttons.
Nail changes.
During treatment, your nails may change color. This gradually goes after treatment as your nails grow. Your nail might separate from the nail bed and look white or yellow. The nail may eventually fall off but usually grows back. 10. Soreness, redness, peeling on palms or soles of the feet. Hand-foot syndrome. The skin on your hands and feet may become sore, red, or may peel. You may also have tingling, numbness, pain and dryness. This is called hand-foot syndrome or palmar-plantar syndrome. Moisturize your skin regularly. Your healthcare team will tell you what moisturizer to use. You may also get a rash on your arms, face or chest. 11. Muscle pain. You might have muscle pain during treatment. Let your treatment team know so they can advise you on how to reduce it. You may get pain in other areas of the body, such as the bones and less commonly your joints. 12. Lack of energy. This is usually mild. You can do things to help yourself, including some gentle exercise. It's important not to push yourself too hard and eat a well-balanced diet. Talk to your doctor or nurse if this effect is stopping you from doing your usual daily activities. 13. Fluid buildup. A buildup of fluid may cause swelling in your arms, hands, ankles, legs, face and other parts of the body. Contact your healthcare team if this happens to you. 14. Taste changes. Taste changes may make you go off certain foods and drinks. You may also find that some foods taste different from usual or that you prefer to eat spicier foods. Your taste gradually returns to normal a few weeks after your treatment finishes. Occasional side effects. These side effects happen in between 1 and 10 out of every 100 people, between 1 and 10%. You might have one or more of them. They include constipation. Drink plenty and eat more fresh fruit and vegetables. Your nurse can give you laxatives to help if needed. Pain in different parts of your body. This might be muscle, tummy, abdominal, chest. Tell your doctor or nurse if you have any pain or tenderness. Changes to your blood pressure. Tell your nurse if you feel dizzy, faint, or if you have headaches, nosebleeds, blurred or double vision, or shortness of breath. Blood clots that can be life-threatening. Signs are pain, redness and swelling where the clot is. Feeling breathless can be a sign of a blood clot in the lung. Contact your advice line or doctor straight away if you have any of these. Changes to your blood sugar level. If you have diabetes, you may need to check your sugar levels more often. Pain, swelling or redness around the site of the infusion. Tell your nurse straight away if have any of these signs. Changes to your liver. These don't usually cause symptoms but are picked up on blood tests. These usually go back to normal after treatment has finished. Irregular heart rhythm. You have tests to check for any changes. Bleeding from the lining of the food pipe, stomach or bowel. You might have symptoms such as bloating or feeling full after eating, feeling or being sick, indigestion, and pain. Dehydration. Rare side effects. These side effects happen in fewer than 1 in 100 people, fewer than 1%. You might have one or more of them. They include heart failure, inflammation of the food pipe, esophagus, and small bowel. Symptoms include heartburn and pain when swallowing or in your stomach. After watching, please don't forget to comment down below. Like, subscribe and hit the notification bell for more videos. Thank you for watching.